Well, we received a phone call from the physician explaining to us that there was a prescription error and it resulted in the death of a child. We checked our records, and sure enough, we found that we'd made a mistake. The initial shock set in, and it was our worst nightmare as a pharmacist, that an error had caused the death of a child. After this incident occurred, I had a couple of things I had to stand back and evaluate. Find out if I enjoyed the profession. Was this my fault? Was this the system's fault? Where did the error occur? Can it be prevented in the future? And when I did that, I realized that this is a profession I chose and I enjoy, and that I was going to continue on with it.
No matter how much public trust there already is invested in a particular sector of the economy, whether it's medicine, where we have to have medical help as people, whether it's aviation, which has become an integral part of the society, the fact is that if the public decides at any given point that they cannot trust a particular segment or sector of that industry, then that particular sector is in deep trouble.
When the Institute of Medicine report came out in December of 1999, there was an estimate of 44,000 to 98,000 deaths every year by a preventable medical adverse event. 7,000 deaths every year from medication errors alone. That doesn't mean that's all pharmacists or physicians. It means it's pharmacists, physicians, nurses, patients, all of those things together. What it means for pharmacy is that we need to understand that there's a problem there, and we got to be willing to address that problem.
Safety is about quality, and quality is about learning. And I think it's critical then for senior management in each organization to communicate to all other staff how important patient safety is.
There is a responsibility that is literally national in scope for community pharmacy to rise above, in many circumstances, the normal, reasonable barriers that are always there among competitors. We have to look at ways that the community pharmacy can become the leader in trying to prevent medication errors in all their different levels of complexity.
Pharmacy's changed dramatically over the last 25 years, and one of the things that we've had to do is to really focus our efforts on trying to figure out how to do things in a safe manner with the changing environment that we live in.
If you're really going to have improvement, you have to learn from your past experience and even hypothesize what could happen in the future and then get better. So you really have to look at it from a systems perspective and say, blame isn't the answer. The answer is understanding why things happen the way they did, and then taking the measures to make sure they can't happen in the future.
There are always things within the systems where we work and outside of our own systems that contribute to these errors. And so instead of asking about who made the error, more and more it's becoming, as is appropriate, what allowed that error to take place.
From my years of experience on the board, I can't even think of one case where we could actually say the pharmacist was incompetent and that's why the mistake happened. It just hasn't been that way. It's been because something went wrong. Something in the workflow broke down. Pharmacists need to have a process in place that works to diminish errors, and they should be disciplined for not having a process, not for making a mistake.
My past experience certainly at NASA was very valuable. With NASA, both the emphasis on spaceflight and safety there, as well as aviation in general, was really applicable to healthcare. It's applicable to anywhere, and it's think about things as systems, realizing that it's not just one person's job to get everything done.
If pharmacies want to improve their quality and decrease their error rate, they need to have a system in place. They need to have a structure that leads to an appropriate process, and then that process will lead to good outcomes.
We're beginning to recognize it's the system failures that allow these errors to happen, rather than the people failures. They're two separate things. We certainly can make mistakes at any point. What we have to do is go beyond that and focus on our systems and improve the systems that we work with.
We always need to know not only what goes wrong, but what goes right in order to adjust our system to maximize the opportunity for zero defects And that is something we can probably never achieve, but we can get incredibly close.
All caregivers play a critical role in assuring safety and good outcomes for the patient, and clinical pharmacy is certainly one of the major players. Many patients have more frequent contact with their pharmacist on refills of prescriptions, etc., than they do with their physician or other caregiver. I think by the community pharmacist seeing what's going on, it adds one more redundancy, if you will, in the care pattern for our patients.
In quality, it really can be said that quality is free, but it can also be said that a failure of quality steals profit directly from the bottom line.
Some of the things that contribute to errors in pharmacy are product placement, sound-alike drugs, look-alike drugs, drugs when they're written down by a prescriber look like something else. You have errors because there's a breakdown in the system somewhere. Usually what you see is that the pharmacist got distracted and didn't follow the steps.
Many pharmacies are beginning to use checklists before they dispense a medication to a patient to assure that they don't overlook something. So they'll have things on the checklist like the name of the patient and their location, their age, their weight. Other medications need to be checked. There's a question about that. And as you go down through the list, it really helps you to recognize there may be some things that you otherwise would have overlooked.
The use of technology is something that we've begun to embrace. We use robotics to help fill the prescriptions, and the use of barcode technology to be checking the stock bottle to the finished product, images of the tablets or capsules to make sure that it's correct. Regular communication with our employees is essential, from regular meetings, staff meetings, to talk about the issues that we have, to making sure that when we do have issues that we talk about them. We need to learn from the mistakes that do happen.
Sharing information is crucial to preventing mistakes from happening again in other situations. We should get the information out as quickly as possible, because usually if it's happened in one place, it certainly is going to happen in another place.
When the board did their investigation, I thought they were very supportive. They looked at the questions of how and why and the systems involved and basically how the error occurred. They didn't look to point fingers at anybody. They didn't really want to know more or less even who. They wanted to solve the problem, find out why, and prevent it from happening again.
Most consumers know that pharmacists are human and that mistakes can happen. What they're looking for is to make sure that you're aware of it and that you care and that you don't want this to happen to somebody else.
You've got to put together a plan of some type and you've got to implement it. But before you can do any of that, there's got to be a real commitment, and we found that the real difference is whether management makes a commitment to quality.
Safety is not just a tip of the spear or the tip of the iceberg. It is the foundation of quality. The opportunity for not only protecting the public, but also for raising the awareness of all of us in healthcare that this is a central focus of safety. Right there at that pharmacist station, that's where it all begins.
This is just the beginning, first ripple. It's going to crest to a huge wave, because as people understand more and more that we just don't have to do things the way we've always done them, that there are ways to do it so we can prevent these things from occurring, that we don't have to have a bad event before we learn from it. As that becomes more understood, people won't be able to do anything but emphasize it more and be smarter about how we do business.
This is a wonderful time for community pharmacy to step forward with their activities to promote patient safety.
A prescription for quality and patient safety. Create a culture of safety in your organization. Focus on systems, not individuals, and move beyond blame. Create a learning organization that allows staff to openly share what they have learned from incidents, near misses, and successes. Use appropriate technology. Remember that addressing human factors remains essential for ensuring quality. Learn from other high-performance industries. Use checklists. Enhance staff communication. Simplify workflow procedures. Reduce distractions in the workplace. And create backup systems. Understand that community pharmacy is dependent on public trust. Commit to making quality care the foundation of your community pharmacy practice. This project was made possible by unrestricted educational grants from Adventist Pharmaceutical, Cardinal Health, GlaxoSmithKline, Script Pro. And with support for the Institute for the Advancement of Community Pharmacy's Patient Safety Fellowship from Pfizer. For additional copies and information, please visit www.advancepharmacy.org.